So good evening, everyone, and welcome to today's session of Saturday Talk by JanyuTechnologies. Today, we are once again having Dr. Arunkumar Sampath as today's speaker. Dr. Arunkumar ji has a 27 years of experience in the gamut of automotive and aerospace defense fields, including sustainable mobility, 5G networks, AI and edge computing, HEV, EV, hydrogen and fuel cells, drones and air taxis, autonomous and connected technologies, automotive electronics, cybersecurity, EV charging, etc. His PhD from University of Maryland, USA in the year 1997. He's currently employed in Tata Consultancy Services TCS in Chennai as Principal Consultant and Industry Advisor, Bangalore. He also worked as a project lead for NVH development in hybrid vehicles at Daimler Chrysler. Today, Sir is going to speak on improved productivity and better health insurance, which is the impact of technology-enabled wellness programs. Over to your own, Sir. Thank you so much.
This actually came up as a trigger of discussion based on our client interactions with insurance firms. It was about 6 months ago, 7 months ago, when we have been talking to, because currently I have taken it as a challenge to work in advanced technology in new areas. So I have deliberately started contributing to the BFSI, the banking, finance, and insurance, that particular business segment, one of the largest business segments in TCS. So in that BFSI, I stands for insurance. I have had an opportunity to interact with the clients in insurance, and that actually triggered this particular idea. So what I have noticed is when you look at the statistics, okay, for example, the worldwide COVID-19 trends impact on people, especially with pre-morbid conditions. You're able to see the screen, right?
Yes, sir.
Okay. Oh, not the second slide? I'm on second slide.
Yeah, now we can see the second slide.
So what you notice is the worldwide COVID-19 trends impact on people with pre-morbid conditions. Across the world, whether it is US or UK or Germany, Italy, France, China, India, Japan, Brazil, etc., you notice a very common trend. The trend is people with pre-morbid conditions, especially with respect to obesity, for example, high blood pressure, etc. These are the people that that particular segment of population has been significantly impacted by COVID-19. Okay. Then even after the COVID-19 has passed, in the sense that everybody has taken medication and they have recovered, etc. But you notice that their health condition has not exactly improved, in the sense they have not been productive as much as they were probably before that. That's number one. Number two, the world is still recovering from the ill effects, in the sense it impacts the productivity of not just an organization that this particular segment of population works for, but it also impacts the entire GDP of the particular country and of course the overall GDP of the world. Okay, so there are lots of impacts. For example, there is an impact on the family life. Okay, so across the world, people with pre-morbid conditions, they have been suffering, and poor health and fitness costs about $1.8 trillion in USA every year. And unfortunately, the health costs are actually rising significantly. And if you look at the expenses of an employer today, just for argument's sake, let us say you have 10,000 employees in your organization. When you look at the expenses that you have, for example, mandatorily insurance has to be provided, etc. When you look at the care costs, they literally contribute up to 50% of a company's profits. In the sense, they eat up into your profits significantly. So on one hand, it's a social issue. On the other hand, it's a business issue, financial issue. So there is a significant amount of pushback from the employers that the employees have to take care of their own health. But at the same time, employers are also proactively providing them healthcare and wellness programs, so that the overall costs with respect to health insurance and medical treatment, etc., could go down. Number one. Number two, the productivity could be higher. Number three, there's something called presenteeism. I will touch upon that in the next few slides. So that will also go down. Okay. So there is a win-win situation with respect to somebody proactively participating in the overall wellness and preventive healthcare programs. Okay. Now, so when you look at the trends, it is primarily social and behavior, in the sense, when you notice that these people with obesity and high blood pressure, etc., you notice that it is very less hereditary, but mostly it is because of lifestyle diseases. Their eating habits, their physical activity habits, maybe their smoking, drinking, whatever. So it is primarily dependent on an individual, and then the environmental, social, and then the behavioral aspect. Okay, nothing to do with technology, nothing to do with hereditary, whatever. So you notice that almost 70%. Okay, greater than 70% of people, the health improvement could be realized if they are able to make specific changes in the social and behavioral aspects. Okay, so you got increased focus on prevention than cure. So this is the fundamental aspect. So approximately 80% of Americans describes their job as stressful even today. Okay, and 95% of medical costs go towards treatment, whether it is depression, whether it is maybe some lifestyle disease, whether it is because of your obesity, etc. Maybe heart conditions. It could be anything. So, and unfortunately, in US, if you look at the statistics, in the next say 5 years or 6 years, almost 50% of the population will be designated as obese. That's a challenge. And I don't know if you notice this. Unfortunately, Indian population is not very far. Indian population is also reaching these statistics. So we have a challenge. Okay. So approximately $6 billion of cost is incurred due to reduced productivity and job absenteeism. Means because these people are falling sick more often, there is a challenge. So what the companies are doing, especially the large organizations and even in government, what they are doing is they are providing what is called the wellness programs, where they are encouraging employees to attend social activities, physical activities, maybe on-site what you call gym facilities, etc. Or maybe they are getting certain discounts if they go to a gym, that kind of thing. So there are specific benefits, and what the organizations have realized is for every $1 that they spend, they are getting almost 6 times the benefits. Okay. So it is a win-win situation. So why am I talking about this? I'm talking about this because of the overall social impact, financial impact, and also insurance impact. Because at the end of the day, employers have to provide specific insurance, and the costs are also, impacted due to these social behavioral changes. Now, how do you monitor an employee? I mean, you can always, because these days technology is there. For example, smartphones have, all kinds of sensors, etc. They can track the number of steps you are taking, and in fact, people can wear smart watches or sports watches, or even, glasses, smart clothing, etc. So as long as you are able to have specific smart wearable, and as long as it is possible to monitor your performance in real time, especially let us say somebody has a long-term medical condition, okay, and if that medical condition is getting worse, for example, somebody has a heart condition or somebody has some specific Alzheimer's, those kinds of onset of specific conditions. So it is very important to monitor that person's physical activity and fitness, so that the productivity, etc. could be tracked. So essentially there are multiple dimensions with respect to wellness. Now here comes the biggest challenge. When you look at the statistics of the working population around the world, almost 50% of the working population fall under millennials and Gen Z consumers. Okay. The good news is they are highly conscious with respect to health and wellness. But the biggest bad news is they may be physically fit or may be conscious, but mentally there are specific challenges. So I will come to that particular information in the next couple of slides. So what you notice is what the Gen Z millennials are saying is, hey, you know what? We are ready to adopt the technology. We are ready to get the real-time monitoring of our physical conditions, etc. However, it has to meet certain criteria so that we can readily adapt that. So these are specific activities, and they are signing up to specific wellness programs provided by the organization, so that it's a win-win situation. Okay. Now there is another trend that is popping up in the workplace. It is called presenteeism. In the sense, you may be coming to work only because you have no choice. You come to work, but you may be having a back pain, you may be having a leg pain, you may be having some neck pain. You may be going through some mental issues, depression, maybe you are from a single parent family, or maybe somebody is going through a divorce. There could be multiple aspects. And because of the health issues, you may be financially on the lower side. There could be a challenge with respect to finances. And because of that, you are going into depression, all kinds of challenges. So the productivity of an employee, of an individual is significantly getting impacted. So as a manager, as a let's say factory a foreman or something, you may be noticing that a person is not exactly fully productive due to multiple reasons. And unfortunately, when you notice at the statistics, you notice that the depression is the biggest contributor. And unfortunately, lots of times people do not open up. Means unless they open up, you don't know what's happening. Okay, this has been the biggest challenge in the recent work trend. So the presenteeism, impacts multiple aspects, especially when you look at the women's health. Okay, what you notice is because women also constitute almost like 40-50% of the workforce among Gen Z and millennials, and if they do not open up, especially with respect to mental health issues, there's a big challenge. Okay. Though Gen Z women are better educated and are tech savvy and are decently, earn good amount of salary on par with men, unfortunately, because of these depression and mental health issues, the suicide rates have been found to be much higher. Okay, so this is another area that the organizations are trying to focus. Okay, there's something called LIMRA trends. If you look at the, if you can just go to Google search and then you can look for it. What these trends show is, as you go from baby boomers, let's say people who are in their 60s, 70s right now, to Gen X, somebody like me who is on the wrong side of 50s, to let us say millennials who were born just before say 2000, to Gen Zs who have been born after 2000. When you notice that the green is actually reducing. What is this green? The green is saying that you are doing decently well, doing well with respect to no stress or let's say little stress. So what you notice is, as you go from the baby boomers towards the Gen Zs, they feel that they are under severe stress. Why? It's kind of difficult to judge, even though they are educated, they come from decently good family backgrounds, financially well done, they are making decently good salary, etc. But somehow the mental aspects are getting impacted. So this has been a challenge as per the LIMRA trends. So what the organizations are trying to do is, they are trying to categorize or they are trying to customize the wellness programs, especially around the millennials and then the Gen Zs. Okay, so that wherever there are, let us say I have a Ponds factory or let's say Hindustan Lever factory. Okay, I have plants in Switzerland, US, China, India, whatever. So I can always come out with the demographics. I can always come out with this kind of statistics, and I can design my wellness program with respect to insurance, etc., for that particular plant, for that particular country, for that particular location, based on what the demographics is and what the challenges are. So that's exactly where the organization are going towards. Okay, now what you notice is, almost all the companies or even the governments, they are organizing and they are providing general wellness. Okay, but the biggest challenge has been for them is the weight loss and the stress management. What they are saying is, this probably the employees have to contribute much more, because an employer cannot do much beyond a certain limit. They can probably provide, and in fact they are even providing tobacco sessions, for example health insurance premium discounts. As I told you, if they are able to participate in a gym or a yoga session or something like that, they are getting discounts and all this stuff. So there are certain trends that are evolving that the employers are able to offer. Okay, now, so these are essentially the smart wearables. Okay, and the millennials are adapting this, and then they are saying that these are specific criteria that these smart wearables need to match. And in fact, this has gone up to almost $500 billion worth of business in US, and it's actually growing. So a lot of people are jumping into it, whether it is Medtronics or Siemens or Philips or other healthcare companies, and in fact Apple, Google, whoever, everybody is jumping into this particular business. Can you see slide number 5 now?
Not yet.
Slide number 5?
Yes.
Okay. Yes. Okay. So presenteeism, as I told you. Okay, good. Presenteeism is a challenge. As I told you, you may be going into a work with say specific health issues. You may not be able to, for example, you may be having, leg pain, neck pain, etc. Depression is another challenge. So the employers need to figure out how do you, customize the wellness with respect to that particular. So as I told you, women's health is also getting noticed, because unfortunately, even among the millennials and Gen Zs, the suicide rates have been increasing, especially in the developed world. Okay, so this has been a challenge. And as I told you, the LIMRA trends. Are you able to see slide 6? Slide 6. Hello?
Yes, we are in slide 6.
Yeah. Okay, good.
As long as you click the slide, it is changing, sir.
Acha, okay, thank you. So as you notice, this green is actually going down from baby boomers towards the Gen Z. Green is essentially lower level of stress. Green is good. Higher green is good. Lower green is bad. So what you notice is, as you go from baby boomers who are in, let us say, in 60s and 70s, etc., towards Gen Zs who are in, say, their 20s, etc., you notice that their stress levels are going significantly higher, means the green levels are going down. So lots of organizations, what they're saying is 48% millennials and Gen Z workers constitute the workforce. And even among them, about 40 to 45% are women. So you have specific challenges with respect to customizing your wellness programs towards this particular demographic. Okay. The next one is companies offering wellness programs. Why are they doing it? They are doing it because they want employees to be productive and then contribute to the growth of the organization. Okay. So they are encouraging people to lose weight. They are encouraging people to manage their stress, especially with respect to social programs. On when you look at TCS, for example, TCS sponsors marathon. For example, Mumbai Marathon, Delhi Marathon, Sydney Marathon, New York Marathon, Boston Marathon, etc. In fact, Chennai Marathon was there just about 4-5 months ago. So that's number one, where you don't necessarily have to run, say, 20 kilometers, but as long as you participate, as long as you socialize with your fellow employees, etc., you can probably bring your family that day. You can have some good time the entire Sunday. You can, so the idea is not to necessarily participate in a marathon and win a certificate or something, but the idea is to socialize and then have a good time. So that is what the organizations are focusing on. So this has been the trend. Now what you notice is slide number 8, smart wearables. So the biggest challenge for the sensors and the smart wearables has been, number one, miniaturization. Number two, how do you make sure that you can package as much computing as possible with less power and less memory usage, etc. That has been the second challenge. The third challenge is you cannot always transfer data to a cloud and do the processing in cloud. You should be able to do some minimal calculations and have some minimal intelligence on the edge at the smart wearable itself, on the sensor itself, whether it is a watch or a glass or a ornament that you are wearing or an anklet that you are wearing, etc., or some clothing or some implant that you have. So there should be some level of computing, edge computing, some intelligence, some algorithms, etc., need to run, so that if there are any abnormal activities, any abnormal data, if the data is normal, not a problem. But if there is some abnormality, that is with respect to your temperature, blood pressure, heart rate, etc., then there should be a signal that should be means there should be a red alert saying that XYZ person is going through some challenges. So, or let us say, especially with respect to old people, if they are bending down to tie their shoelaces, vis-a-vis they are falling down. So how do you identify the difference between somebody bending down to tie a shoelace vis-a-vis somebody falling down in a bathroom or something like that? So these are some of the challenges that you have to face to design the algorithms, especially with respect to IMT sensor, IMU sensor, and all those things. And then for example, inertial sensor, all those, how do you figure out to calculate that particular response? Okay. So this has been the next thing is what is called the neuromorphic computing. This has been an emerging technology. So compared to a regular distributed computing, neuromorphic essentially mimics the brain, how your brain processes the data, and then it can accommodate these chips that are available in these specific sensors with lower power but decently high computing power. So this is where the emerging technology is. This is where TCS actually has filed some patents, and we are offering specific capabilities to let's say insurance clients or some other client with respect to our IP. So that is what we are doing right now. Okay, and the key success factor means you should be able to integrate the sensors with the processor. As I told you, you should be able to do the computing on the edge itself and then build the intelligence there. Number one. Number two, you should be able to have a standard protocol of communication. Number three, how do you integrate the neuromorphic core with the digital communication through FPGAs or microcontrollers? So that has been another challenge that the device manufacturers or the designers, etc., are trying to this one. And the next challenge is, if an individual is wearing, let us say, multiple sensors, the sensors will capture data at a different frequency, different kinds of data. For example, ECG is different, EOG is different, your body index, etc., is different. So how do you make sure that you fuse the data to come out with what is called a multi-sensor fusion? This has also been another challenge. Now, once you do the multi-sensor fusion, how do you go towards AI/ML algorithms? You input the data, you get some output, and then you process the output with respect to a dashboard display, whether that is a red signal, whether that is an OK signal. So these are all the algorithms and the challenges that the TCS is focusing on, in addition to the neuromorphic computing. Okay, so this is what are being offered to the insurance companies, and it is being offered to specific companies, let us say General Motors or Toyota or let's say Boeing, Airbus, etc., who are able to provide some of these wellness programs to their employees. Okay, now are you able to see the screen? Yeah. So AI/ML and generative AI. So one of the challenges that, as I told you, you have the data and you have multiple sensors. So you should be able to do a sensor fusion, come out with the data, process the data as much as possible on the sensor itself, do the edge computing, build the intelligence, and then what we call take a decision, means or help an individual take a decision. So the re-emphasize with respect to AI/ML is not necessarily to process the data, but make it user friendly, means natural language processing, means you should be able to provide information in local language, let us say Tamil, Hindi, Marathi, whatever. You should be able to do it, number one. Number two, if you are integrating with respect to Gen AI, lots of times Gen AI comes as a black box. So how do you make sure that there is no bias? How do you make sure that the output is explainable? In the sense, it's not a black box. You're able to explain the data. You are able to explain the logic as to how that output is generated, etc. Okay. And another challenge is, if you are having a specific medical condition, and let us say you are seeing a doctor, but you are an employee in an XYZ organization and you have signed up for a wellness program. So if a doctor or let us say your HR manager, etc., has to work with you, they have to figure out what is called the vertically trained large language models with respect to Gen AI, where for that particular condition, for that particular individual, there could be specific large language models that will see the trends of that particular individual. Okay, so this is where the technology is evolving right now. The next one is the human digital twin. What the organizations are doing, whether it is a Siemens or Apple or any of these healthcare companies, what they are doing is, let us say you have specific heart condition, or let us say you have some bad liver or a kidney or whatever. So they are able to digitally map that particular subsystems within an individual, and then take the data. Let us say if you go for annual health checkup, you can monitor the data over the last 5 years. If there has been a degradation, if there has been specific activity change, some food diet habit changes, etc. So they are able to proactively identify any negative trends and give a warning to an individual saying that, hey, you know what, there is a challenge here, we notice something negative here, you should be watching for this. So that kind of a preventive aspects are being focused on right now. Okay. The second thing is, as you age from let us say 40s to 45s to 50s, etc., they are able to digitally map your subsystem and the whole body, and then they can also understand how you are aging over a period of time. Let us say somebody has been diagnosed with cancer and somebody went through some treatment. How is that cancer figuring out? Means, is it relapsing? Is it okay? So that kind of a monitoring also can be done over a period of time based on the human digital. So that is also happening right now. Okay. So as I told you, the subsystem mapping is happening. So this information will be provided to the hospitals, etc., where you may be going for your annual health checkup, treatments, etc. And as I told you, over a period of time, how your body is changing, how your physical activities are changing, etc., that could also be tracked. That is where the technology is evolving. And the next one is, lots of times people complain that they are not able to access the wellness programs, etc. So what the technology is evolving is towards AI driven conversational UIs, where using the natural language processing, you are making it much more user friendly. It is like instead of you typing some let's say prompt in the Gen AI, some medical terms, you are having a conversation, such as you are having a conversation with a chatbot kind of an environment, where the cognitive load is low, it is not exactly high, but you are able to get to what you want. For example, if you say, look, I have high blood pressure, I have XYZ condition, I want to get this kind of a treatment, so that the chatbot assistant will direct that particular individual towards what he or she is actually looking. So that is where the technology is actually evolving. So TCS is working on this aspect also because we have specific capabilities in Gen AI and AI. So in fact we are very strong with respect to NLP. So we are working on AI driven conversational UIs. So conclusions is increasing need for healthcare and wellness programs, especially post-COVID. Specific trends have been observed, and unfortunately, more than the physical activity, the mental health has been observed as the biggest challenge in the millennials and Gen Zs, who contribute almost 50% of the workforce, especially women, where even though they are well educated and come from a decently financial background, etc., owing to mental health conditions, the suicide rates have been found to be higher. So what the organizations are trying to do is improve that particular aspect. And as I told you, because of the lifestyle, almost 50% of population in US in another 5 years will be considered as obese, and that is being taken as a challenge by a lot of organizations saying that the productivity, there is a challenge, means it impacts the productivity, it impacts the lifestyle of that particular individual, it impacts the family life, financial life, etc. of that particular individual. So the organizations are actually proactively encouraging these employees to participate in wellness programs. And technology is evolving towards neuromorphic computing, smart wearables, and human digital twins integrated with GenAI. That's where the trend is. Thank you very much. Future, when you look at it, GenAI will have much more, and instead of Internet of Things in the healthcare and the wellness programs, it is evolving towards what is called the Internet of Medical Things. And wherever there are specific devices, etc., you will always have a cyber hack challenge. So this is also an evolving field. That's all. Thank you very much.
Actually, a very interesting topic has been taken for today. I have one or two questions. One is that
Yes,
with India having such a Aadhaar card-based system, are there any government initiatives to digitize the medical records of people, or is there any initiative that is happening? Secondly,
see, as part of go ahead, please.
Secondly, I think we talked of wellness, which is very important, but in an industrial climate where people are working at various sites and various locations, accidents do happen. So the wearable industry, how is it gearing for these type of situations where accidents can be avoided using the smart variables? And one broad question, last question is that with all these interventions in IT and AI and everywhere, is the real cost of medical expenses declining, or are we sort of aping the West as far as the West medical costs that will come in times to come? Because will it affect to increase or decrease the costs as of now, other than inflation?
See, I will give you some statistics. When you look at the number of medical colleges or AWMS compared to say 10 years ago, you can notice that for Honorable Prime Minister Modi ji, he has inaugurated multiple AIMS in multiple cities, states, etc. You may be wondering why is he doing it. It's because the number of cases are actually increasing. The number of patients with specific medical conditions, etc., are increasing. If you notice, today India has the highest number of diabetic patients in the world, the highest in the world. Okay, that's a statistic. You can just Google it and find out. Number one. Number two, because of that, there is a significant impact on that particular individual, that family, the productivity, etc. And unfortunately, these diabetes, etc., a lot of people are saying that it is not exactly hereditary, in the sense it could be controlled, it could be contained with respect to your lifestyle changes. So that is where the focus will be on, number one. Number two, when you notice lot of people, they are probably just sitting on their desk. They are not exactly doing any physical activity, and a lot of people, maybe the youngsters especially, they may be hanging out till 11 o'clock, 12 o'clock, 1 o'clock in the night, and they are probably going to bed, etc. Not because they have any medical condition, but they think it is cool. But there are specific impacts on the health. Okay, so this trend is also actually increasing. So they may or may not realize, but there is definitely an impact on their physical condition. Okay, means the overall wellness. So this has been the observation, and this has been the trend that is happening. So a lot of times we say, when I was a kid, somebody used to say, diabetes and all, it's a rich man's disease. Poor man doesn't get a diabetes. Okay, that was the common norm when I was a kid. But these days, everybody gets it, whether it is that person is an auto rickshaw driver or whether that person is a CEO. So this trend has happened in the last 30 years. So how did this happen? That's one thing. Second thing is, unfortunately, the number of cancer cases in India are actually significantly increased. Okay, and you may be wondering, it is not exactly hereditary. It may be because of multiple conditions. I am not an expert in this, but there are multiple conditions contributing to it. And number three, if you look at the obesity, okay, unfortunately in India, the obesity is going significantly higher. In fact, I traveled to Northeast last year, and I was in the Himalayas just about 2 weeks ago. None of the people in the Himalayas, Pahadi log, because they work very hard and they do a lot of physical activities, none of them have any paunch or any, overweight, because they do lots of physical activities, especially in the Northeast or even in the North, in the Uttarakhand or, Ladakh, Kashmir, whatever. Whereas you see a different trend in different parts of India. That's not because those guys are eating completely healthy food and, people in Maharashtra or Madhya Pradesh are eating bad food. It's because of their lifestyle, maybe physical activity, whatever. So that will definitely have an impact. That's the second. The third thing is, somebody asked a question, is the government digitizing it? Yes, through Ayushman Bharat, through the health insurance card, etc., they are able to track what kind of medical treatment you are going for, what kind of insurance costs are getting incurred, etc. It is still in the beginning stages, but it is happening. Okay. The next thing is, somebody may say, hey, you know what? Yeah, US ka problem hai, Japan ka problem hai, India ka problem nahi hai. No, it will come. This was there. Let's say in obesity was a problem in, let's say, in US or some other places, but it has come to India. Diabetes was probably a problem in, say, Western world. It has come to India, and the other things will also come to. Okay, sooner or later they will come to India. And the idea here is to prevent, because prevention is always better than cure. That is what the organizations are focused. Thank you.
Arunji, good evening. I have a question. Recently, actually, our Dr. Chari was on some diplomatic mission to South Korea and other countries. So there were also in South Korea, it's surprisingly, I think 0.007 or 0.07 is the population growth rate. So they are almost predicting, I think he had a list of countries which will not exist in 49 years, 74 years. I see there are some lists happening, a list of countries being prepared now who will not have the population. So this is one point. And another thing, this is more an observation. Another point, we are talking about the youngest population globally. India is having the largest number of youth. Assume 30 years down the line, it will turn out to be the largest number of elders, right? So, are we preparing? Is there any government schemes for 2047? We are talking about in many schemes. In health area, is the government working towards that? Is there any information in that?
Yeah. See, Ayushman Bharat has been one area. Second is, what the government is trying to do is, if there are specific, healthcare issues, up to 5 lakhs, they are saying that we are able to cover your medical expenses if you fall under, let's say, economically weaker section, etc. That kind of a thing, they are doing it. Because what the government has realized is, it is always good to have a healthy population, working population, that can contribute to the GDP growth, that can be productive. And a bad, somebody with a bad health or some health issues will definitely not be able to contribute as much as a healthy individual. So that has been the focus of the government. So that is happening. To what extent it is happening, to what extent do you see the results, that is still a moot point. Maybe the results are not exactly up to expectations, but definitely steps are taken in that direction. There is definitely a gap. That gap has to be addressed. Maybe Niti Aayog or somebody is looking.
Thank you so much.
Thank you. And another area, the biggest challenge in India, more than anywhere else, is awareness. A lot of times you notice, especially women. In fact, I don't know if you noticed, Infosys, Foundation Chairman Sudha Murthy ji, she mentioned in Rajya Sabha just 2 days ago, especially girls, wherever there could be preventive medication, preventive vaccination with respect to, let's say, cervical cancer, etc. Because of the stigma, because of they do not want to expose, or they think there is a stigma that somebody in the social stigma, etc. So they are not getting vaccinated, they are not taking the medication. So they may not realize at the age of 14, 15, but maybe at the age of 30, 40, they will definitely see the impact of it. So what she's saying is, the government should proactively encourage these young girls to get vaccinated. So that also is that has been put forth in the Rajya Sabha just 2 days ago.
Okay, thank you.
Any more questions?
So what TCS has done is, we are trying to address from a technology perspective. In the sense, insurance companies are saying, hey, you know what, our costs are going up year over year, and the large companies that are signing up to our insurance program, they are also complaining that their costs are going up year over year. That is impacting their bottom line. But it's a social cause, in the sense the government is also pushing the organizations to increase their wellness. But there can only be so much that they can do, because at the end of the day, there has to be proactive steps to be taken by the employees. Employers can only do so much. So this is where the balance has to figure out, and that is where lots of studies are being done. And how do you come out with an actuarial model based on the input, where you can say, hey, you know what, this person is a high risk insurance premium individual, whereas this one is a medium risk or a low risk, etc. Because the biggest challenge in US, not necessarily in India, is discrimination. If there is a discrimination, there will be a lawsuit. So you have to figure out the insurance premium, etc., without being discriminated. So that has been the biggest challenge given to TCS. So that's what we are working on right now.